Hello and welcome to Alabama Care, y'all. I'm your host, Antwain, and today we've got a special guest with us. This is Alanna Burks. She is Mateo's nurse, who we get 5 days out of the week. And today we're just going to be going over, what's it like being a nurse and being a caregiver to not only just Mateo, but special needs children in general. So to get started, let's kind of let the audience kind of get to know a little bit about you. Where are you from, Alanna?
I'm from Indiana.
So what brings you here to Alabama?
My mom passed away last year, and my sister lives here, so we decided just that I would move to Alabama.
Okay, so mostly just having family and having that support system was what kind of brought you down here.
Definitely.
All right. So let's kind of get the viewers knowing, like, where did you get started with all this? How did you get into the medical field and nursing care in general?
I started out as a medical assistant when I was 22.
Mm-hmm.
And then, so I did that for like 13 years, and then I went back and got my LPN.
Okay. And so have you always worked with children with special needs, or where was your beginning at?
I would say just children in general. I like the kids.
Okay. So about how many special needs children have you cared for then?
I would say maybe 8.
8? Oh, were they all the same or are they all different?
Oh, all different, definitely.
Gotcha. So you've worked with a wide range of individuals in regards to excuse me. I just wanted to make sure that we've got the comment section up. You've worked with a wide range of
all different, definitely.
So you've worked with a wide range of individuals. Sorry. Should have had that up earlier. I apologize, you guys. But you've worked with a wide range of individuals. Were all of them as complex as Mateo, or?
I would say they're all different. You know, some of them can speak, some of them can eat, some of them are on vent, some of them are not. I really don't have any preference. If they're on a vent, it's fine with me.
Okay. So, what ended up being your interest into actually caring specifically for children with special needs? Because it seems to be that that's what you work on instead of just kids. It's special needs children in general. What drove you there?
I don't know. I was working office work, and then I did home health, and that's when I ran into all the special needs, and I decided that I love home health with the kids.
Okay. So you guys, I have a special guest here with me today. This is also my daughter. So she'll be chiming in and out while she's watching her cartoons. Marcy, say hey to the viewers.
Say hi.
Okay. And then, so where were we? Were at, why are you interested in caring? So how is caring for a child with special needs different than a child without special needs for you?
Well, I mean, they can't communicate, a lot of them, so you have to figure out, what hurts them. Are they okay? So they're a little harder than, the average child that can say my belly hurts or I don't feel good.
Actually, so you're really good. That's one thing I picked up about. You're really good at reading on signs and symptoms, specifically with Mateo in regards to that. And that I feel like that's a required, not a required, that's a acquired skill set, and it takes a lot of time. It takes a lot of patience to be able to do that.
Yes.
Oh, have you ever had an emergency situation while caring for a special needs kid?
Well, you know this one. I'm gonna go ahead and bring up Mateo. Okay. So Mateo, he dropped down to about 42 for the oxygen. It ended up being what do you call that? Plug.
Mm-hmm.
So anyway, I actually called 911, and the firemen and the police came here. Antwain, I called him as well. So yeah, that was kind of scary. But now I probably didn't need to call 911 because I didn't give him time to respond to come back up because it made me nervous. So I went ahead and called 911. But by the time I even got off the phone with her, he was already back up.
I definitely remember that day.
Yeah.
I remember I was actually working for this company doing outdoor sales at this time, and I was getting ready to get on the highway to 65 when I got that phone call from Alanna saying he deset down into the 40s. I've called 911. They're on their way. And as soon as she had told me that, I see these fire trucks coming down the road, heading in the direction towards Mateo. And so I flipped a U-turn. I came running back to the house. I was following the fire truck all the way back to the house. And yeah, by the time we got back there, Mateo was perfectly fine, stable. I think he was sitting at like 97, 98
Yeah, he
oxygen.
was.
I think he was just upset that I was leaving.
There you go.
Sarah Williams said, "Oh, she's so cute. Say thank you, Marcy." Uh-oh. All right. So when caring for children with special needs, what do you find the most rewarding?
I like to keep them clean. I know that's kind of crazy, but I love giving a bath. I love them, just getting everything clean. That's my thing.
Yeah, I know. Every single time, if I wash Mateo before you get here, you're like, "Oh man, he done stole my bath
I
time."
know. I do like giving a bath.
So what are some tips that you can share with caregivers in general as a whole, or other nurses that out there that may be watching this view with us? What are some tips that you think you can offer them to, help further their career or their passion?
What do you mean?
Just like tips like you would recommend. Would you recommend that they, stay well connected with the special needs community?
I think the community, and I think the parents, because even as a nurse, even though I'm here 50 hours a week, I don't know. I still don't know the magnitude of, how difficult it is.
Exactly.
Because I'm only here 10 hours or, 9 to 10 hours, but I know it's difficult for, the parents just to even get a break,
Definitely. So we are your first patients that you've had here in Georgia. What was that
Alabama.
like, or Alabama, excuse me. I'm from Georgia. What was it like for you in Indiana?
Kind of the same thing. I worked office and then I decided to do home health. So um, I was with a 13-year-old female with spinal bifida. She was on a vent. I was with her for 3 years. And I worked with her up until I left and came to Alabama. So.
Okay. Sorry, 1 second. Just making sure that is not the host calling me. No. All right. And so in Indiana, so you had a patient that was 3 with a trach. Is that so? Between Mateo and the patient that you work with in Indiana, are those the only 2 trach patients that have taken care of?
No.
No. So you've dealt with a lot of trachs over your career.
I have, yes.
Okay.
More in home health.
More in home health.
Yeah.
Now, when you say you worked in the office, in an office job, what were some of your responsibilities there?
I worked in a pediatric office, of course. So just the yearly checkups, injections, sick visits. But the main thing was the yearly checkups, and you had to do CBCs and different things on them. So
okay, let's see if we have any questions or comments from our audience yet. Hey Sarah, how are you doing? Thank you. I just saw that. And so let's go over with some of our viewers. What's your daily routine? How does your day look like when you're working with Mateo?
I try to schedule everything the same. So he's on a routine, I'm on a routine, so I don't forget things. But the main things: bath, medicine, activities. I try to get him up in his wheelchair, or do tummy time, or do some kind of stimulant, whether it be smells or touches. So I just entertain him. So
makes sense. I apologize. Come here, Marsamoot. Oh, she is always trying to get into everything. And so that's one thing that I've noticed with you. You're very consistent with your routines. First from the morning that we get here, you start with the medicines. After the medicines, you get him ready for his bath. After his bath, you start working with him on PT. What is What is one of your favorite routines besides like the bathing that you go over to? Are you did you always do PT with a lot of your other patients, or was that done by somebody else?
I know it was done by somebody else in Indiana. They had a physical therapist come in
Okay.
for certain kids.
So kind of like Mateo does when he's here, except the only thing is we've only get the 1 day a week with PT
I think
through
that's
school.
I think that may be what they got as well. Maybe 1 or 2 days of PT.
Okay. And so you just take a lot of your learning from when that PT is here and take a lot of those lessons and just try and incorporate them into your daily routines.
Definitely, like OT, especially,
Hmm.
because they can show you different things to do.
Definitely. So what are doctor visits like for you? Let the viewers know what doctor visits are like when you and I go to doctor's appointments.
They are exhausting.
The-
It's just a lot of stuff to take, but it's an experience too. I just want to help out Antwain and Mateo, so definitely with me there is just a extra hands on. So
Definitely. I mean, between having to carry his wheelchair, his vent, his suction machine, his feeding pump, his diaper bag, and that not so light wheelchair,
right,
getting it in and out of the vehicle is a big thing. And I just can't say thank you so much for the amount of support and the amount of work that you actually do when you're doing all this. Do you foresee staying in childcare for and specifically special needs in the future, even if hopefully you don't depart from us in regards to switching other patients, but I know things have to happen.
right.
You're going to stay working with
I am
kids.
gonna stay, and I think I can do it anywhere in any state I go to. I can do pediatric home health. So
I know we kind of talked about it earlier on about your education. What was it that you had gotten your cert? So you're a certified LPN, right?
yes.
Do you plan on possibly going back to school and getting your
I thought
bachelor's?
about it. I should have just bridged when I was LPN. You could bridge to the RN, but I did not. So I don't know. I doubt I will.
Is it available for you to still technically bridge now, or is it okay? So you could still technically pick it up at any
I
point in
could
time.
bridge to the RN program. Yes,
And what's the biggest difference between being an LPN versus an RN?
probably the pay.
The pay. So as far as like the overall care and required requisites, it's pretty much the same, just a little bit extra further in that schooling and whatnot.
Right.
Okay,
Yes.
makes a lot of sense. I know when we used to live in Georgia, they told us, and specifically in Georgia, that in order for us to have a nurse, they'd actually have to be a registered nurse because they require a registered nurse to
For
be
the
there
vent.
for the specifically the event.
Hmm.
So it's really great that they don't necessarily make that a requirement here in Alabama because, like I said, I don't know where I would be without you.
Right.
Um,
Yeah. I'm glad they don't do that either because that doesn't really make any sense. But
Yeah, because I mean, at the end of the day, a lot of those times we'd have registered nurses come in, and when they come in, they still themselves would not have the background working with a vent. Just because you're a registered nurse doesn't necessarily
right.
mean you understand you work with the vent. You have to work with those patients.
Yes.
So, would you ever foresee yourself going to work for a pediatric hospital then in the future, or do you think home health is where you plan on staying?
I think I'll stay in home health. I've already done all the office work, work all the hours every weekend. So I'm past all that now.
Makes sense. And it allows you to spend more further time just focusing on one patient instead of having
Yes,
multiple patients over and over.
definitely.
So I know that could be a big hindrance or and a stress an added stress factor to your life.
Yes,
Do you think that makes it better for you then to be able to care for your patients, knowing that you just have the one?
yes.
Good.
Mhm.
Let's see. Do we have any questions from the audience just yet? Just want to make sure that I'm not missing anything. I do not see any. Uh, so you offered some tips earlier, just saying that you make sure that they stay connected with the parents as when you're as a caregiver, communication is a big key. What tips can you offer to somebody who's maybe possibly just even looking to take that step to working and uh I guess like an environment like this, home healthcare, what tips can you offer them? What are some of the first steps somebody can take if they want to be, a caregiver help?
Well, there's all kinds. You can do respite care, come in and clean. You can be a nurse. You can be like a sitter, I think, that you can just sit with the patient and can't do anything medical with them. Um, but I definitely love the home health. I like the one-on-one, and I've worked 40, 50 patients in a day. And I don't choose to do that anymore.
So if somebody wanted to kind of do your line of work, obviously, obviously recommend schooling. Is there like a first step that they can take prior to LPN to kind of get them into that door?
I think they just have to see what the school requirements are.
Okay.
Because of course you have to have a GED, and there's some that you have to pass, math test, English test to even be accepted. So,
Okay. And so, working with the agency that you work with now, do you ever get a chance to actually meet some of your other colleagues?
I do not.
No. Is that
No.
something that you do miss about?
Now the last home health agency I worked at, I got to meet everybody. I would go to the office to drop off my paperwork or pick up my check or what have you, or even to train. And I just got to know everybody there. I enjoyed that.
Do you miss having something like that?
Yes and no. It would be nice to get out and meet people, conversation, but then you have to worry about, if you have 50 people that work here, everybody has 50 problems. And
The
then,
office counselor.
yes, and then if they call in, then you have to pick up theirs, and it's a lot.
Definitely, I completely understand. I'm actually working with somebody now who's in one of our special needs community, kind of creating a group that kind of helps connect not only us parents, but caregivers. Actually, we just started the group over this past weekend. So eventually, like maybe we can get some of these home health agencies and nurses to kind of get in on this group, and that way you guys have a community be able to share information.
Mhm.
Because even though you're with one person or one patient, I feel like there's still a lot of information that you guys can learn
Oh, yeah.
from each other,
Mhm.
and opportunities that you all can learn from each other.
Yeah, I haven't met anyone at my
Yeah,
besides the bosses,
of course, yeah, and I'm pretty sure the pandemic plays a big role in that. They don't want anybody coming into the office per se and whatnot.
Yeah, that's true.
Um, so I know you had mentioned an difficult emergency situation working with Mateo. Is there one that stands out to you while working with any of your other patients as well?
With Kaylee, she had, very big raging seizures. So, anytime she would seize, it would last, a minute or two of convulsion, so we just had to make sure she was protected and that she didn't hurt herself. But, it was scary. Is she going to come out with a seizure, or is she, you know what I mean? So that's always scary.
With her being in her bed, was it a special kind of bed that she had to use to kind of help make sure that she stayed protected?
She did have a nice bed, and it would have paddings on the sides, so she couldn't fall back into it because she's set up. So anytime she would seize, she would either fall forward or fall back.
Okay. And was it like a medical bed that she had, or was it a
Yes.
custom bed? Oh, what was that called?
Um, Beds by George, I think.
Beds by George. And was that covered by Medicaid
It was covered by Medicaid in Indiana.
in
I
Indiana?
don't know
Okay.
about here.
I'll definitely have to take note of that, or I'll just ask you after the end of the call. But that's some good information to know. So for any individuals out there who have special needs children who suffer from convulsive type seizures, there's an opportunity that we might be able to look into that allows us to be able to get those kinds of tools needed. I think that's a great thing that they did for her. So therefore, she didn't have to worry about bumping her head. It was padded. Now,
Yes.
did the gates go up and down on it too as
They
well?
did, yes,
Okay.
because you would have to get her out of the bed, and the bed also elevated, so it would either roll up or you could roll it down.
Oh, okay. Some
And they even have ones that have like tents on them too.
really,
That's if kids, fall out of their bed or, get out of their bed. They have one where you can zip it up.
and that kind of prevents them from being able to get into trouble or hurt
Yes.
themselves or anything like
Yes.
that. Okay. Um, Now, how long do you plan on staying in the Alabama area? And would you be interested in future opportunities with working with other kids with special needs?
Um, I mean, I don't know how long I'll be here in Alabama, but
Mhm.
I'm happy where I am right now.
Hmm. Awesome, awesome. Me too. And that question was more for me. I just need to make sure that he's going to be sticking around for a little while. Had to sneak that one in there. Sharon says, "Hey, Sharon, how are you doing today?" So we don't have any other questions coming from the gallery. Is there anything that you want to just offer up in general? Not even necessarily tips, but some stories.
Um, no, I don't really have
You
any.
just don't have any stories. Um, um, let's see here. So, can you actually do what you're doing in regards to working with children with special needs or disabled without actually having a actual bachelor's degree or anything? Is there like a certificate training program that you can start off getting?
I don't think so.
Okay, so
Not as far as trachs and vents and all that go. I think a lot of companies have where, if you're going to work with a patient on a vent or a trach, that they send you for training, just because they're different. Everybody's different. Every trach vent is different. So if you know one machine, it doesn't mean you're going to know the other machine.
that is true. They
There
have
are a
much
lot of
different.
machines, a lot of different equipment that's basically the same but different.
I think I remember you telling me before that one of your patients used to have a feeding pump too as well. Did they use the kangaroo or did they use the infinite pump?
No, they did the kangaroo.
The kangaroo
Yeah.
pump. Yeah, there's so many different types of equipment out
Yes.
there that it's crazy. Um, Having a good mouse is definitely paramount. Thank you so much, Sharon, for chiming in. It is so hard to find and keep a good one, a good home help. I'm fortunate to say that in the beginning we did have a little bit issues with finding a nurse that can help and care for Mateo, but on the third nurse, Alana's been with us since March of last year, and we're very blessed to have her here. She helps make sure that he stays in routine, and not only that, she helps make sure on days like this, even or sometimes she'll pick up days in the weekend. It helps me with my daughter too as well while I get errands done. So I'm definitely thankful for having you. You mean the world to all of us. My little one here. Let's say hi to the viewers. You definitely are like family around here.
And for the record, he spelled my name wrong. It's
Two N's.
Two N's.
So yeah, so if you guys look at that, that's supposed to be what is it?
I love you.
We from Sharon, she says, as a nurse, what's the hardest part of working in a home?
I would say the hardest part is maybe just getting to know the routine, the family, the bedroom, because there's so much stuff.
Yes.
I mean, just stuff. Where's the clothes? Where's the socks? Where's everything? So I think that's the hardest, is getting to know the family too. Some of them are friendly with the nurses. There are some that are not.
Mm-hmm.
So,
Would I'd like to think that we have a friendly relationship.
Oh yeah, definitely.
That's one thing I can say. I thought I was organized when you had first came here. For the most part, like I always knew everything was. I have cubbies, I have everything that's put away. But you are extremely organized.
Day one.
From day one, that first day, I remember I was like, all right, here's everything that I've gotten, for Mateo. This is what I use on a day-to-day basis. And at this point in time, Mateo spent his time either sleeping with me in my room or with me in the living room. And I was like, so at this point in time, I was working for a company and Mateo would spend his time in the daytime in the living room throughout the day, with all his equipment, his suction machine, his feeding pump, his vent, and would just kind of be out there. So he didn't feel like he was always like staying in his room. But it was a lot having to always transfer that stuff from the bedroom to the living room every single day.
And then back at night. Yeah.
And so she came in and I was like, here's everything that you need to know. Here's everything that needs to happen. I was like, and then we had like 4 boxes that were stacked up at the door that we were waiting, that I had just gotten from Thrive, like maybe 2 or 3 days prior, that I just hadn't got a chance to put up with taking care of both my kids, and it was over the weekend thing. And I come in here, I'm working, I keep one earphone off so I can make sure I hear if his pulse ox beats or his pump goes off. So, you know, we can work back and forth in regards to, so she gets to learn Mateo. And I went through a whole entire work day, didn't hear anything. Mateo had a really great day. You know, and I go out there periodically to check. And next thing you know, I go out 2 hours later after telling her not to worry about anything. And she's got all his boxes unloaded. She's organized and reorganized his whole entire room. And I couldn't even be mad at her. I was like, I was like, you know, I was thinking, you're here to help me with Mateo, make sure that Mateo is doing well. And next thing you know, I've got this completely organized room that's like 10 times more organized. We've got cubbies that have cubbies for cubbies. Everything's just completely organized. So I just want to thank you so much too, as well. Like, organization really helps.
It does.
Caregivers, parents, it really helps making sure that everything is done, that you don't miss out on certain routines. When you're a little bit disorganized, you end up becoming anxious and you sometimes forget to do certain things. And with the way that she's helped me set up everything now, it makes it so easy just to go about the day and doing things. She is a great nurse. Yes, she is, Sharon. Thank you so much. Let's see, we have organizing is crazy with trach kids stuff so much. It definitely is. But the way she has everything organized with the trach, if you want to go ahead and explain that, how do you have everything set up with trachs?
I just have them in separate bags in certain containers.
I know, I love it when your routine that you show me with bath time.
Oh, yeah.
We've got now. So we've got a tray that goes into one of these little cubbies, and we pull out, and it encompasses everything for the bath time. What do you put all in there?
I got Qtips, peroxide, gauze, tape, any kind of ointment he needs, lotion, lip balm, you name it. It's in there.
Like our go-to tray. Yeah, right after the shower, you pull out, and then you don't have to move anywhere else in the room to get anything done. Like, everything's right there. There's triamcinolone cream, there's trach chains. Now, were trach changes scary for you in the beginning? Were you always able to do it by yourself?
At the beginning with Kaylee, I was a little nervous, but she would cough. Mateo does not cough. Kaylee would. Usually when you pull the trach out, they cough and they cannot breathe. Mateo can breathe. I don't know how. But yes, he does breathe without his end.
Well, he's getting stronger, that's for sure. He's able to breathe completely through his stomach without it collapsing on him. It's a crazy thing, but we were so thankful to have it. It makes it so much easier for us just to do his day-to-day maintenance and care on him every day, as far as like not having to worry about his breathing. So and she says Sharon said that her night nurse is the very same exact way. She helps get her organized and everything like that.
Good.
So how far is the drive for you from
Birmingham?
From Birmingham. So
it's about 20-30 minutes drive.
And Sharon, as far as your son can't what? I'm sorry. She had said, my son can't, he terrifies the nurses. That's not a good thing. Oh, you mean he can't breathe when he gets his trach taken out? Okay, I think that's what she was trying to get at.
Right, yeah, most cannot, but Mateo can.
So with your other, that's interesting actually. So with all of the other trach patients that you take,
you have to pull it out and put it back in quickly.
Really?
Like, yes, like have one ready, you pull one out and you put the other one in.
Wow.
With one, yeah.
I actually never knew that. I thought, so I remember I think I told you this discussion that I had with one of his.
Yeah, they didn't like that.
They did not like that at all. I was like, yeah, I can take his trach out. He can breathe through his stomach for about 7-10 minutes. Not like I tested and actually do it, but like if I forgot something, say I forgot the, to split the gauze before actually starting the process, because sometimes they don't give us enough split gauze. We have to cut them up or whatnot. I'm like, yeah, I can take it out and just cut it, get it ready, put some nystatin on it. His trach will be out and he just breathes right through it. And she like looked at me, was like, Don't do that. I was like, but he breathes fine. He stays at like 95, 98% oxygen. Like,
He does do fine, but most do not. Once you pull it out, you have to put another one in, or they gasp for air.
wow, that's interesting. I actually never knew that.
Yeah. And a lot of times they cough. You know, once you pull it out, it makes them cough.
And Mateo does sometimes when I do his trach change, he'll cough, but like it doesn't close up.
Right.
You know, it doesn't like close up here, and he doesn't seem to struggle having taken.
He doesn't.
So he's definitely one of the kind of patient that I always keep trying to remind his doctors, specifically his pulmonologists. Like a lot of the routines that you normally do with most trach patients, you don't have to necessarily do with Mateo because he is very strong. So we're definitely fortunate for that. You do check change, yeah. I've been doing trach changes by myself since probably 6 months after he had his trach installed. Like it's just some kind of appliance, just installed, but placed. Yeah, exactly. And to me, I actually find it easier to do it by myself than it is with the help of somebody else. Wouldn't you say the same thing?
Definitely.
So
definitely.
Yeah, it's just I feel like having those extra hands in such a tiny area.
Yeah, too much stuff.
Or like, and I know communication. We always tell you guys communication is key. You know, so if I were to have to do it with somebody else, you know, I'll be like, all right, this is what I'm going to do. This is what you should do, or whatever. So in case, so I know in hospitals they ask that a lot too as well. Where they'll call in a nurse, will call in like the respiratory therapist to kind of come in and give them a second hand, but I find it easier just doing it.
Yeah, I haven't found any difficulties with trading them out.
So we see we've got Sharon says we went through a period of having a problem getting trachs in. Now that was scary too. That was scary. 2 years his stomach would shrink and would have to force them in. It was horrible. Oh my goodness. Were you using the lubrication jelly and everything and still having the issue, Sharon? And we'll just wait for her to give a response back. But wow, that is that is not good. Did he had the laryngomalacia, correct, as well? Because I remember in the beginning with Mateo, we've never actually no, we've never had to take that size down. We had that size down. You know how like we have the 3.5, and then the 4.0 Bavona is what he currently actually uses. We've never had to use the smaller size trait.
Once he went up.
Yeah. Once he got his trait placed, we've never had an emergency situation where we're like, okay, the big one's not working, the normal size one's not working. We have to take that step down. And so you said it was after 2 years, I believe it was, that 2 years that everything. Do you think that a lot of that has attributed to the fact that maybe he has gotten stronger, maybe better upper airway strength, and that's why you're able to change it out now easier? It took 4 of us one time to get a trach in at the ER. Oh my goodness. He had to have a revision done in Atlanta. Wow. We did have one period in time with Mateo where we had the 4.7 Bavona and he ended up having some, what was that down there?
Scar tissue.
Granulation.
Granulation, yes.
Some granulation because in Atlanta they wanted us to go up on his Bavona length or whatnot, but when they went up in the Bavona length, it ended up causing more of that granulation going on. So now we're back onto the normal size Bavona, so we're on a stand-up, not custom. Are y'all using a custom trach now, Sharon? I think we've got Mateo's doctor's appointment coming up in March, I think within the next week or two, where they're going to do a bronchial scope on him. I think I told you about that. We're going to check and make sure that his current trach doesn't need to be revised to again as well.
Make sure nothing's that's healed up there as well. Yeah. Did you say no?
No.
So he has a standard one. It looks
Yeah, the standard one. Oh, okay, that makes sense. I think for the most part, they always use standard sizes, unless like
I
absolutely
think so,
necessary to
unless
as well.
right.
Because the way they seem to tell us when we were talking about it when we first started custom back in Atlanta, that wasn't a common practice for them to use custom ones, and it takes
Oh,
longer for insurance to get approval, a lot
right.
of extra work and whatnot. So.
Mhm.
Old school Shiley. The Shiley is that's just a one. That's not even a one way. That's just the cap, I believe. So we get those in with Thrive every week. You'll probably see them. It's just a little white cap.
Mhm, has a
Um,
pointy thing on it?
no, it's just a white
Oh.
cap that goes over the trach. It doesn't allow air in or out.
Oh. Mm.
So forcing them to breathe all through by mouth and nose the entire way. We have them, but we never actually use them. Is when you say old school style, I'm actually kind of interested in wondering what that looks like because I was always under the impression that the Shiley was just a simple cap over. Um, so we went over, having the special certificates. Went over when caring with children with special needs. What do you call them? I was wondering. And then I guess last but not least, is there something that you want to say to the audience in regards to um, just anything surrounding kids, advice, recommendations, anything.
We need to reset the video real quick.
Oh no. Okay. Sorry, you guys. We're having one. There we go. I think we are back. Sorry
We're
about that.
back. Sorry.
We had technical difficulties. Well, with that being said, I just want to thank you so much for jumping on the call, sharing your experiences being a caregiver of children with special needs, and let you know how much we appreciate you and everybody else like you working in the industry, looking out for these kiddos, man, because it's difficult, and having your helping hand and having others having those helping hands really makes a world of a difference for us. It keeps us from going completely insane.
Right,
So thank you
exactly.
so much.
You're welcome.
Let me see. I think Sharon says it's a regular, so she's got a pediatric 5.0 trach, is what she was saying. So yeah, as far as that, we don't have any more comments from Alabama Care there or questions or anything like that. So I just want to end this with saying thank you so much. Really appreciate the time you spent here today and the time that you spent with Mateo and Marcy as well. I want to say thank you to everybody out there as well for jumping in, watching the video, getting some insights on what nursing care looks like with Mateo and overall experience that Alanna has shared with us. And just wish y'all the great rest of the weekend. Thank y'all so much and have a great one.
Thank you.